I decided to have dental implants because I'd had problems with my teeth in the past, and I decided that it would be a good idea to improve my overall smile in general. So I sought out a dentist who could supply a good quality implant, and that was Martin. Okay. I had read up quite a lot in the past about dental implants and was rather concerned about, well, the level of surgery that might be necessary, cutting through a gum, stitching, and I've read articles where people have been in quite a lot of discomfort with that. So overall, I arrived to have the treatment. Martin sedated me before commencing, obviously, and I was quite surprised that this new method of doing an implant doesn't involve any too invasive surgery of any sort. He used some kind of screw that went directly into my jaw, and I imagine straight through the gum anyway. And then afterwards, it was 2 months to heal. I came back again and he put in a temporary cap and cleaned up around the area, checked that all the implant had grown into the bone successfully and so on. And I'm now waiting for the final process where I've now had some checks done to see that everything's okay, and it appears to be. And Martin will now put the final implant on, and that will be the end of the procedure. As far as discomfort's concerned, obviously when you have the procedure done, you do feel a little bit uncomfortable for a while. And in the past, I have had problems where I've had crowns and things, and I've developed an infection afterwards. But for some reason, presumably because it was done at a higher level of quality, I had no discomfort at all in the sense of any infection incurring afterwards. I think for about 2 days afterwards I took paracetamol just to take off the background pain, but it wasn't intense, and it was just to give me something a little bit more comfortable while it went on. It certainly gives you more confidence, and obviously it gives you a full set of teeth again, so eating food and so on is much more easy to do. You don't tend to, for example, I like to eat a bag of crisps now and again. If you have no teeth in certain areas, you can catch that in your gum. Well, having an implant obviously makes that much better than it was before. So yes, very good. I think I would definitely recommend Osteocare implants to friends and family because as far as I can tell, the treatment is not as invasive as other methods. I was very quick to heal afterwards, and I haven't seen the final result of the implant fitted to the main work, but I imagine at the end of it, it will look very good as well. And in terms of my overall confidence, I feel much happier smiling now than I did without the implant. So yes, I would recommend it to other people.